Thank you, Madam Chair. As this is my first hearing on the House Budget Committee, I just wanted to express my great appreciation to you and to our ranking member, Mr. Yarmouth, for your leadership and guidance, and I'm looking forward to working with everyone on the committee. Madam Chair, last week over 2,000 people joined me in Seattle in support of the Affordable Care Act and demanded that it not be repealed without a replacement and that we in fact focus on expansion. I heard from many who are seriously terrified that their health care will not only be stripped away, but that there is no replacement. Sally is a single 80-year-old woman who told me that she would be severely affected if her Medicare benefits were cut. She worked for 30 years, was healthy, until 3 years ago when she was diagnosed with a serious cancer. Medicare benefits covered much of her hospital and treatment costs, which she could not have paid for on her own. She said, if Medicare is cut or reduced, I will be struggling to keep up with healthcare costs. Madam Chair, I agree with you that this is about real people, and this is just one story. I've heard hundreds. I would like us to consider the big picture. In the state of Washington, my home state, a repeal of the ACA would mean 750,000 people would lose their health care. Almost 3 million people in Washington state with pre-existing conditions would not be guaranteed coverage anymore. And speaking of pre-existing conditions, being a woman would once again be one of those pre-existing conditions, as we would have to pay out of pocket for cancer screening, Pap tests, and birth control. Our state benefited greatly from Medicaid expansion. 605,000 people gained coverage and would once again be without health care. And 55,000 young people in Washington state who are barely getting by would once again be kicked off of their parents' health insurance. There are no winners with an Affordable Care Act repeal, Madam Chair, and that's why I hope that forums like this can be focused on what we can do to make it better, but a replacement plan, which has not been offered, instead of nothing. I wanted to say I come from the state Senate, which is controlled by Republicans, and the chair of the Healthcare Committee in the Washington State Senate, Senator Randy Becker, recently said this is not a partisan issue, this is a bipartisan issue. She believes that any replacement should build or improve the reach of Medicaid expansion funds. In Washington, this represents about $3 billion and the majority of the funding received under the ACA. So Dr. Bloomberg, can you speak to specifically Medicaid expansion and the states across the country who have benefited from Medicaid expansion?
Sure. There's been a big infusion of federal dollars into the states that expanded Medicaid, allowing them to make all individuals, regardless of their family situations, eligible up to 138% of the poverty level for the first time. This has done a lot to improve the financial situations of hospitals in those states relative to the states that did not expand. As my colleague Fred Blavin has shown in a recent JAMA article, this is big financial benefits. In addition, these are comprehensive benefits with no cost sharing, so it makes coverage, access to care incredibly affordable for the low-income population.
Thank you. I appreciated the concern for fairness throughout everybody's statements, and so but I'm trying to understand exactly what you do believe should be covered and some of the provisions of the Affordable Care Act. So just yes or no answers, if you would, for all of our testifiers. Do you believe that young adults should be able to stay on their parents' plan until they are 26?
As long as the $1,200
just
cost
a yes
per
or no, Ms.
worker
Turner. Thank
is
you.
visible.
Was that a yes?
If they want to pay for it.
So that's a yes?
If they want to pay for it. Yes.
Mr. Book?
I think if employers want to offer that, it should be perfectly legal.
Dr. Bloomberg?
I agree, it should stay.
Dr. Hausmeyer?
Irrelevant.
Is that a...
It's irrelevant under either the ACA or the replacement because they'll be treated as their own household anyway.
Let me ask about seniors on Medicare, a critical part of the Affordable Care Act. Do you believe that seniors on Medicare should be able to afford their medications and not fall into a prescription drug gap? Ms. Turner?
Yes, and
Dr.
there are
Book?
creative ways to do that.
Dr. Book?
Could you repeat the question?
Do you believe that seniors on Medicare should be able to afford their medications?
I think everybody should be able to afford everything.
Great, thank you, Dr. Bloomberg.
I agree.
Dr. Hasselmeyer?
Yeah, I mean,
Yes or no, Dr.
comprehensive coverage on drugs
Hasselmeyer?
is fine. I mean, that's...
Thank you. How about making sure that insurance companies cannot deny coverage because of a person's medical history. Ms. Turner?
That was the case before, and will continue to be the case.
So that's a
going forward.
yes. Dr. Book?
That was the case since 1996, and
Dr.
the ACA
Bloomberg?
shouldn't have repealed
Yes,
it.
I agree, but that has not been the case universally
Thank you.
by a
Can
long
you say
shot.
more about that, Dr. Bloomberg?
I'm
Yes,
sorry, the
the
gentlelady's time
Thank
has
you. I
expired.
yield back.
I apologize, but we have so many other members, so